We are back with Dr. Sarah Kitts with Cone Health Alamance Skin Center, and we're talking about skin cancer. So these are the quick true or falses. Okay, true or false? People with darker skin don't need sunscreen.
That is false. Everyone needs sunscreen to kind of protect you from skin cancer and skin aging.
Okay, this is one that I hear often from my own family. True or false? Do base tans protect you from burning and sun damage?
That is very much false. I don't like the concept of a base tan. Anytime you're getting like a tan or a burn on your skin, that means you're getting kind of UV damage, DNA damage, which predisposes you to skin cancers.
Let me ask you this. Does a base tan mean that you're going to get better tan the next time you go out and it's going to protect you at all from burning the next time?
No, actually a tan only has like an SPF of 4, so it's really not good protection.
Good to know. Okay, how about this? True or false? Does only sun exposure cause skin cancer?
That is also false. So sun exposure is a big one. But we can also see genetic syndromes that predispose people to kind of early skin cancers. Patients who are on immune or drugs that suppress your immune system can also predispose you. And then the last thing I always put in this category is tanning beds. So not the sun, but one of the worst things you can do for your skin.
Yeah, tanning bed's not any safer than being outside in the sun.
No, definitely not.
Okay, all right, so we talked a little bit about sunscreen. What about clothing, like types of fabrics or colors and accessories or something like that?
Yeah, I love sun protective clothing. I always encourage my patients to get it. You will always find me in a long sleeve shirt just because I think it's easier than kind of lathering on sunscreen every day. When you are looking for sun protective clothing, you do want to look for stuff that's UPF graded. And so that essentially means that the fibers are woven tightly enough to provide that level of sun protection. Some patients will wear like a linen t-shirt or a cotton t-shirt, but that really doesn't provide good protection. And the other thing I always encourage is a wide brim hat. So something that covers your face, ears, and the back of your neck. That is a lot better than a baseball cap just because those don't cover the ears and the back of your neck. And we see a ton of skin cancers there as well.
Okay. What about recommendations for protecting like young kids from the sun? Do's and don'ts for that, and they do not like getting sunscreen on them.
That is very true. I have a 1-year-old at home, so I know how hard it is to kind of protect little kids from the sun, but it's definitely very, very important. I would say from 0 to 6 months of age, the recommendation is that to actually just keep your baby out of the sun. So no sunscreens. You can use like lightweight sun protective clothing, but just stay inside, especially during peak hours. At 6 months of age, you can start using sunscreens. I like to recommend more mineral-based sunscreens. So that's stuff like zinc oxide, titanium dioxide. It's a little bit more gentle on the skin. And then I love sun protective clothing for babies. I think it's a lot easier than trying to kind of like wrangle a toddler and put sunscreen on them.
Okay. In addition to taking, all these different steps to prevent skin cancer, we also need to be checking our skin for any kind of warning signs. So what are the warning signs?
Yeah. So when I think of skin cancers, I think of 3 main types: basal cells, squamous cells, and melanomas. Basal cells are actually one of the most common types of skin cancers that we see. For basal cells and squamous cells, I always tell patients it usually presents like a pimple that won't heal or a scab that won't heal. And so anytime you have a non-healing spot, I usually say give it maybe 2 to 3 weeks max, and it's not going away. That's a sign to come in and get it checked out. For melanomas, we think about the A, B, C, D, E's of melanoma. So you're looking for moles that are asymmetric, meaning you can't fold them in half. They have irregular borders, color variation, so dark browns, light browns, pink, diameter bigger than a pencil eraser, and then moles that are evolving over time or changing over time. If you notice any of those things, you definitely want to come into dermatology and get them checked out.
All right, we've got a little bit less than a minute. How often should you be going to see the dermatologist?
Kind of depends on your history. If you have a history of skin cancer, it's usually every 3 to 6 months to yearly. And then if you don't have a history, I would say every year is good. And sometimes that can be spaced out even more. But it's always good to get in for that baseline check to determine your risk long term.
All right, I'm glad you went over some of the true and false, and no, a base tan does not work and it's not good for you. So thank you for joining us today. If you missed any of this, maybe you need to send this to someone else who uses those kinds of terms. You want to let them know what the doctor actually says. This is going to be in the To Your Well-Being of our website.